Hello, hi, I'm Hameed Khan, and I was one of the speakers by expert by experience speaker for the National Voices How to Dismantle Inequity um, conference. And my whole session was about, speech was about the importance of understanding the digital exclusion and inclusion, the fine line between the two. For example, I had open heart surgery in 2019, and during the pandemic, I was asked by my heart consultant to have a video conference call, which I was able to participate due to being able to use Zoom and Microsoft Teams. On the other hand, my mom, who doesn't speak, who speaks no English, has no technology skills, had faced multiple barriers during the pandemic due to not being on digitally competent. So we looked and explored uh, in the conference about how do we challenge some of these digital exclusion barriers? How do we ensure that people who are not just digitally illiterate, how do we encourage them to gain skills to become digitally competent? But also, we discussed other factors like data poverty, which is a big factor for people who are on low income or have very little money. We talked about devices. If you don't have the right iPad, tablet, laptop, that is also has created a big barrier. And then we went on to looking at some of the interesting workshops that took place in the afternoon. One was about looking at the human in the digital, and the other one was about looking at how organizations have worked in terms of supporting and enabling and offering services through online. And one of the things really importantly that was discussed about that even though there is a digital in the human, that it's very important when providing services to have the compassion, the care, the the importance of being competent, having effective communication, to reach out to wider audience and making sure still high quality services provided through the online platforms. Also, one of the things that came up frequently in the conference was about different so digital platforms being used by the same organization. Like, for example, the NHS England, I could be having a phone call from my GP, I could have been having with my heart consultant a Zoom call, and then I could have my mental health nurse that wants to use Microsoft Teams to reach out to me. This is not fair on citizens. It's not fair the fact that you have to learn so many different um, um, digital platforms, like how does Zoom work, how does Teams work, how does WhatsApp work. Oh, I now I need to learn Asana. Oh, now I need to learn Slack. And one of the things that we strongly discussed was about importance of developing one digital model that is used across the NHS, regardless whether you're in London, Birmingham, Manchester. NHS England could take control and develop a universal, and there's only one, and it could be branded as NHS own in-house Zoom or Microsoft Team that belongs to them, so that me as a patient, me as a carer, and others know it'll be the same digital platform used. And this is really important, and that was something that was emphasized a lot at the conference. Overall, it was a good turnout and a lot of participation. It has left more food for thought rather than answers to questions, but it's a dialogue that needs to continue, and we need to continue to support the we need to continue to support the challenge by saying, hang on, we want to eradicate or eliminate digital exclusion to the best as possible. Thank you.